Hi, it's Steve with Magnolia Pharmacy, and I've got our expert pharmacist here.
Hi, I'm Lisa Beam.
And today we want to talk about a topic that we get a lot of questions about, and there's a lot of really unique things that can be done to treat it, which is PCOS, or Polycystic Ovarian Disease. And so we just want to kind of talk about the general disease, kind of talk about some current therapies, talk about some of the latest data, and then really kind of dive into supplements and some alternatives and lifestyles that kind of help a patient kind of diminish symptoms and actually can almost reverse the disease if it's done right. So just starting out in general, Lisa, tell me some of the questions or some of the things you run into with your patients with PCOS. They come in and complain of what type of symptoms?
Yeah, a lot of times it's going to be weight gain, hair growth, infertility, different things like that that they struggle with a lot, especially the infertility.
Yeah, and lots of times those patients too, you'll see acne as a common feature because of some of the symptoms, and really one of the big ways that we know a patient has PCOS is looking at lab markers. Quite commonly, they'll have high testosterone levels.
Low progesterone.
Yeah, low progesterone. They'll have a lot of inflammatory markers that we look for in the blood. They'll have what we call a bad cardiometabolic panel with high insulins, high blood sugars, cholesterol's out of whack. So there's a lot of really negative things that can happen. And one of the things with these patients, Lisa and I were talking before, we were looking at some of the latest data. We really got to look at things that are a higher risk of cancer. A lot of them have infertility problems. I know Lisa's had a really good friends we've had some success with. She may mention during the talk today, but also things can lead to cardiovascular issues, increase of hypertension, heart attacks and stroke, cancers, and a lot of really negative health outcomes as far as that goes.
Yeah. So it's not just the infertility, is what Steve was saying. Like, there's other issues, especially insulin resistance, which can cause to further problems down the line. So you really want to get it under wraps at an earlier age. And actually, one of the things we're looking at alternatives. There's definitely some care that you can get from your doctor, but we're looking at alternatives. And some of the latest research that we were just listening to is major exercise and low glycemic diet that can help reverse this, which is a big deal because before they would tell people to decrease their exercise because they have higher testosterone, but now that's not true. You definitely want to exercise.
Yeah, and like you said, and I think the combination of the exercise with the low glycemic diet, it's like we're going to talk about this a lot, like 1 + 1 = 3 event. There's a lot of the latest studies show that actually if a patient does both of those together, it's more effective than any supplement or medicinal treatment that we can pick. And so, many of us that know us here know we always push diet and lifestyle as major treatment options. And obviously with this, it's probably more so than ever with the PCOS.
Yeah, especially because, as he said, in almost all of these talks that you'll hear, we'll talk about diet and lifestyle. But even more so with this because we always recommend a low glycemic diet. But PCOS patients can't tolerate as many carbs as normal people. They're at higher risk for insulin resistance, so you definitely want to watch that the carb intake for sure.
So let's just kind of briefly talk about that. You say low glycemic diet.
Yeah,
what exactly does that look like?
So
Lisa?
less carbs is how I would think, like in lay terms, you can describe it. And if you're going to have more carbs, you definitely would need more exercise. Definitely no sodas, less sugar.
It's like that spectrum. So you have a lower glycemic carb, basically is such that things like a vegetable. So like tomatoes and your lettuces and broccoli, cauliflower. People don't think of those as carbs or sugar, but they really are. And then you can work more into like your moderate glycemic if they're more active. Like Lisa said, maybe you can eat some fruits and things like that, but you'd want to stick with like apples and oranges and stay away from like mangoes and watermelons and bananas. And then, once again, we're saying these diets, we're pretty much going to stay away from all the white things, all the grains, so your potatoes and your corn and your wheat, and you're especially going to stay away from like the high fructose corn syrup, like Lisa mentioned with your sodas and stuff, because those are just going to really drive this illness to a point where it makes it, no matter what supplement we get, you're really not going to see the benefit as far as that goes.
Yeah, and so speaking of supplements, there's definitely supplements that we're going to recommend as well. The few supplements that we're talking about, like primary that you would give, even if you're just looking at for overall health and not just infertility, are going to be the vitamin D, a fish oil, and a probiotic. And as Steve was saying earlier, instead of the 1 + 1 = 2, those are going to, well, in this case, 1 + 1 + 1 = 3. It's going to be more equal 5. When you do all those together, you can have a really good benefit.
Right. And there was a brand new study that's come out in 2019 showing that it was very beneficial for these patients in lowering all their inflammatory markers and their overall insulin resistance. And as we mentioned, those are two hallmarks of this disease, is that insulin resistance and a lot of inflammation. And those things then typically will drive the ability for patients to lose weight, which is typically a major issue with a lot of the patients that come in with PCOS.
Yeah. And one of the things we've been talking about a lot is the sugar intake. And so you'll see that most of the time if you go to a primary care doctor and they diagnose you with PCOS, one of the first things they're going to put you on is glucophage or metformin. So most of the people that are going to have PCOS are on metformin. So one of the things that we actually recommend here, and if you wanted to help treat yourself, it kind of works just like metformin and you get less side effects, is berberine. So we actually have a product here. We have a few different products. This is one of them that we have, berberine, that you can take every day to help with the insulin resistance.
And like you said, berberine head-to-head, and unlike glucophage, berberine doesn't deplete your CoQ10 levels and it doesn't deplete your B vitamins. So don't get me wrong, glucophage has many...
Or causes diarrhea.
Or causes diarrhea and stomach upset. Yeah, that would be a big problem with people. So no, anyway, but that's one of the things to kind of keep in mind, is that's one of the advantages of berberine. So it's definitely something to consider as far as that goes. Lisa, what else do you recommend?
It's on that same line of insulin resistance and help with cravings would be chromium. And this is one of our chromium supplements as well.
Yeah, chromium is important. Most patients, you'll read a lot of literature about doing like 200 to 400 micrograms a day. But with our patients with PCOS, we're going to push sometimes 1,000 to 1,200 milligrams a day. So that's something else to consider in terms of helping with the insulin side.
Yeah. And then especially with the hormone aspect, there's a few that we would recommend. I would start with chasteberry. And we actually have the chasteberry with the black cohosh mixed together, which is really good. That can help with your progesterone and your estrogen, actually, because the black cohosh, to help raise that progesterone, as well as the saw palmetto, which can help decrease the testosterone levels.
Yeah, and along those two lines, like Lisa just mentioned, about lots of times we'll see a lot of these patients with either typically low progesterone levels sometimes, but also stress plays a major role. And that's one of the things we see too. And one unique thing about this Chasteberry Plus product, it also has ashwagandha. That's another thing. If you have a lot of patients who have a lot of stress drives all the insulin resistance aspect. It also creates more inflammation. And so we also want to control stress, whether it be through diet, like we talked about, better sleep, but things like ashwagandha as an adaptogen lowers those cortisol levels, which can also have a beneficial effect in terms of treating PCOS.
Right, the stress can definitely, like you said, lower progesterone levels, and it actually can cause vaginal dryness as well, which decreases your chance of getting pregnant.
Very good, excellent. One last product that we get recommended sometimes is something called D-chiro-inositol. And this is one product here that's actually got the D-chiro-inositol, but also has some alpha lipoic acid in it, which is also beneficial for insulin levels, especially in your patients that are trying to achieve pregnancy. That's been the real benefit of doing the inositol products. That's been shown to be very effective.
Yeah, so the inositol, myo-inositol can work as well, and we were selling that for a while because the D-chiro can be very expensive. So this one's actually a blend of the myo and the D-chiro, so it's affordable and it has a lot of the D-chiro, which can help better.
Exactly. And then the last thing is, I know Lisa kind of quickly mentioned it, but I'll just throw it out there because we haven't talked a whole lot about testosterone. That is one of the hallmark signs. There's a lot of blood work that needs to be done. And the first thing, and I forgot to mention it from the beginning, Lisa and I are not doctors. We're not medical experts. We're actually just providing the advice for you to make your own good guided health conscientious decisions. But we always recommend you get advice from your doctor or medical practitioner before you decide to do any treatment. Should have put that in the beginning, so I hope my lawyer doesn't get mad. But anyway, we're just trying to provide information so you can make good decisions. But along that too, testosterone levels tend to be high. So it's important to get really good blood work, looking at all your hormones, looking at things like FSH and LH, which also can indicate whether you have PCOS or other conditions. Because what we've learned over the last few years, having cysts in the ovaries, you don't necessarily have to have that to be PCOS. Testosterone's a hallmark, and like Lisa mentioned, the saw palmetto is something that's important to prevent that conversion of testosterone to DHT, which can cause some of the the facial hair type issues that can occur, but also too in terms of some of the acne issues. So.
Yeah. and like he was saying, you don't have to have all the hallmark signs, since PCOS stands for, at the end the S stands for syndrome. You just need some of them. So you do want to see your doctor and get tested to see what you need to focus on. The other thing that I think we forgot to mention that would have been nice in the beginning as well is sometimes these patients, it can just be genetic, but you can reverse it through a cleanse, a liver cleanse, if you have some heavy metal toxicity and different things that are binding to your hormones. Doing a liver cleanse in the beginning before you do anything and following a good diet for like a month can actually reverse your issue, the PCOS.
Right, and that's a great point Lisa mentioned. There's definitely the genetic component, and so many people live toxic lifestyles that are loaded full of, like you said, heavy metals and pesticides and stuff, and so that's very, very critical because, as you know, with us, with these talks we do, we try to do things other than drugs if we can to try to help reverse and treat disease when possible as far as that goes. Lisa, that's about all I got on PCOS.
Yeah.
You have anything else?
Oh, I have a lot more, but you'll have to call me.
No, okay, yeah, that sounds good.
We try to keep these at a minimal time.
If you know anybody that has PCOS, please share this on your Facebook page. We would love to have as many people watch this and learn from it as possible. Also, too, after you get done, if we've brought up a topic and you're like, oh, I have a question about that, please basically put it as a comment on this video, and we'll be more than glad to answer those and provide offer any type of information we can to further answer your questions.
Oh, and the friend that he's talking about is due any day now. She might be in the hospital. I better be getting a call soon.
That's awesome. Yeah, so that's exciting, like you said. But like you said, any questions regarding this topic or any future topics, please comment, and we look forward to having you join us again in the future.
Thank you.
Thank you.